Hi, I'm Daniela,
I'm Brittany.
And I'm Kelly.
and today we are going to be talking about motor speech disorders. So, a little background on motor speech disorders or speech in general. So, to speak, messages go from your brain to your mouth, and these messages tell the muscles in your face and mouth how and when to move to make sounds. There are two forms of motor speech disorders, the first being apraxia. Apraxia affects the messages from being transmitted due to brain damage. Your lips may not be able to move the right way to make certain sounds, or you may not be able to speak at all, in more severe cases. For dysarthria, the muscles that are used to produce speech are damaged, paralyzed, or weakened. This results in disordered movement because of the way the muscles have a lack of control over the lips, tongue, jaw, and other articulators in the mouth. These controls are either in the peripheral nervous system, which consists of the nerves outside of the brain and spinal cord, or in the central nervous system, which consists of the brain and the spinal cord. Some causes for both are damage to parts of the brain that controls how the muscles move. For apraxia, the brain damage can come from stroke, traumatic brain injury, or TBI, dementia, brain tumors, or brain diseases that worsen over time. For dysarthria, the causes are pretty similar to apraxia, such as stroke, brain injury, and tumors, but there are other conditions such as Parkinson's disease, amyotrophic lateral sclerosis or ALS, Huntington's disease, multiple sclerosis, cerebral palsy, or muscular dystrophy.
So some symptoms of apraxia, you would have trouble imitating saying sounds on your own. So you'll add new sounds or leave sounds out or saying sounds in the wrong way. You'll be able to say something right one time, but wrong the next time. You have articulatory groping, which is moving tongue and lips to get them right into the right place. As you try to say sounds, you'll be speaking slowly. You'll be able to say things that you say all the time, such as saying hello or how are you without much trouble. That's called automatic speech. Or you'll not be able to say any sounds at all in severe cases. Some symptoms of dysarthria is having slurred or mumbled speech that can be hard to understand. You're speaking very slowly or you're talking too fast. You may speak softly or you may not be able to move your tongue, lips, or jaw very well. Your voice may sound robotic or choppy. Your voice may change to sounding more hoarse or breathy, or you might sound like you have a stuffy nose or talking out of your nose.
How can SLPs help an individual gain communication skills after they are impacted by a motor speech disorder? For apraxia, they can help them improve how to say sounds and put sounds into words. Treatment focuses on getting muscles to move correctly, saying sounds over and over, using the correct movements, slowing down speech, finding alternate methods such as finding other ways to answer questions or requesting wants and needs. For dysarthria, they are learning how to slow down their speech, using more breath to speak louder, making your mouth muscles move more stronger, moving your lips and tongue more, saying sounds clearly in words and sentences, using other ways to communicate, such as gestures, writing, using computers. This is augmentative and alternative communication, or AAC. For other methods, there's surgical, prosthetic, and behavioral. For behavioral, there's strength training exercises, reducing rate of speech, open mouth approach, and posture control for respiratory support. And these are our references.
Thank you.